Have you ever found yourself reflecting on how aging influences your sexual well-being and desires? As we journey into our 70s and 80s, it's natural to encounter questions around intimacy, satisfaction, and yes, even masturbation. While it's often surrounded by stigma and silence, self-pleasure remains a completely normal aspect of sexuality, regardless of age. In today's discussion, we're exploring 8 key truths every older adult should understand about this topic. We'll examine how aging changes the body, how emotions come into play, and how societal beliefs often shape the way we view sexuality later in life. Recognizing these factors is essential for developing a more accepting, compassionate relationship with our evolving needs. So why stick around until the end? We'll be offering practical advice from experts on how to adapt to these changes, discover new ways to enjoy intimacy, and ultimately reconnect with your sexual identity in ways that are both empowering and fulfilling. Whether you're experiencing these shifts firsthand or supporting a loved one who is, this conversation is designed to inform and inspire. Let's begin this journey with openness and curiosity. And if you find this video helpful, a like would mean a lot. Your support helps us continue sharing these meaningful lessons about aging with grace. If you haven't yet subscribed, I invite you to do so and tap the notification bell so you never miss an update. If this topic resonates with you, drop a comment with the number 1. If not, feel free to comment 0 so we can improve future content. Insight 1. How your body evolves with age. As we grow older, our bodies naturally undergo a range of physical changes that influence hormone balance, overall wellness, and sexual functioning. Aging is a gradual process, often marked by a slow decline in how efficiently our body systems operate. One of the most significant changes lies in hormone production. Both older men and women experience shifts that can directly affect sexual health, interest, and comfort. In men, testosterone levels begin to decrease subtly from their late 30s onward, continuing at about 1% per year. Since testosterone plays a central role in libido and erectile strength, its decline often results in reduced sexual desire and less frequent or satisfying experiences. It can also contribute to erectile challenges, which may lead to frustration or lowered confidence. For women, the onset of menopause, typically between ages 45 and 55, ushers in a sharp decline in estrogen and progesterone. These hormones are vital for maintaining vaginal tissue health and natural lubrication. Their reduction can cause noticeable discomfort and challenges in sexual activity. These hormones play a vital role in supporting vaginal health and overall sexual well-being. When estrogen levels drop, as they do during and after menopause, the vaginal walls can become thinner, less elastic, and produce less natural lubrication. This often leads to dryness, which may cause discomfort or even pain during intimate moments, making both intercourse and masturbation less enjoyable. Some women also notice a decrease in sensitivity, especially around the clitoris, further impacting sexual fulfillment. But hormones aren't the only piece of the puzzle. As we age, changes in blood circulation and muscle strength can also affect sexual responsiveness. With slower blood flow throughout the body, areas like the genitals, which rely heavily on healthy circulation for arousal, may not receive adequate stimulation. This can make it harder to feel fully aroused or to reach orgasm, with sensations that are often less intense than in earlier years. Muscle tone also tends to decline with age, including in the pelvic region. Weakening of the pelvic floor muscles can reduce control during sexual activity and lead to diminished sensation. For many, these physical changes come with an emotional toll. Anxiety, self-consciousness, or a sense of inadequacy can easily creep in, which may further hinder sexual confidence and enjoyment. The good news is that these changes aren't barriers, they're signals. By acknowledging and understanding how the body evolves, we can seek out supportive solutions. Today, a range of therapies, pelvic floor exercises, and medical treatments are available that empower individuals to continue enjoying an active, satisfying sexual life well into later years. Insight 2. Be aware of health risks. Masturbation is widely recognized as a safe and healthy part of sexual expression, but older adults should consider how age and chronic health conditions might influence their experience. As the body becomes more susceptible to physical strain, even seemingly gentle activities like self-pleasure can carry risks under certain conditions. For instance, individuals with heart issues such as high blood pressure or a history of cardiovascular disease should be cautious. Arousal can temporarily elevate both heart rate and blood pressure, which might pose challenges. If you ever experience chest discomfort, dizziness, or difficulty breathing during or after sexual activity, it's important to speak with your doctor. Joint problems like arthritis can also create barriers to comfort. Some movements or positions may irritate sensitive joints. Paying attention to your body's cues, using supportive props, or choosing positions that reduce strain can help prevent discomfort while still allowing for intimacy and exploration. Additionally, medications prescribed for conditions like diabetes, hypertension, or depression may have side effects that influence sexual desire, arousal, or climax. It's helpful to talk openly with your healthcare provider if you notice changes. Adjustments to medication or additional support may restore comfort and satisfaction in ways you might not expect. Insight 3. Mental and emotional well-being. Sexual activity, including practices like masturbation, can provide powerful support for emotional and psychological wellness. When we engage in intimate moments, our bodies release natural chemicals such as oxytocin and endorphins hormones that reduce stress, boost mood, and create a sense of calm and contentment. For older adults, who may encounter specific emotional challenges like loneliness, chronic health conditions, or a diminished sense of purpose, these pleasurable experiences offer more than just physical relief. They help foster emotional balance and personal joy. However, it's not uncommon for many in later life to wrestle with feelings of shame, guilt, or unease around sexual behavior. These responses are often the product of deep-rooted social messages that portray sexuality in older adults as taboo or irrelevant. Over the years, many have absorbed cultural beliefs that label sexual pleasure as something improper or trivial, which can lead to internal struggles, embarrassment, hesitation, or even self-criticism when engaging in or even thinking about intimate acts. Left unresolved, these emotional blocks can damage self-esteem and contribute to a sense of isolation. Shame or guilt surrounding sexuality can become an invisible weight, diminishing one's quality of life and making it harder to embrace joy and connection. That's why open, compassionate conversations about sex and aging are essential. When we bring these topics into the light, we help dismantle stigma, challenge outdated narratives, and affirm that the desire for touch, pleasure, and connection does not disappear with age. It evolves. Medical professionals and community spaces can offer crucial support by providing respectful, inclusive environments where individuals feel heard and valued. When older adults are encouraged to explore their sexuality either with a partner or on their own, they gain tools to enrich their mental health and emotional resilience. Ultimately, affirming sexual health as a natural and worthy part of the aging process paves the way for more inclusive, dignified aging where emotional and sensual well-being are not just acknowledged, but celebrated. Number 4. Social isolation and loneliness. Feelings of isolation and loneliness are becoming more prevalent among older adults, and they don't just take a toll on emotional and mental well-being, they can also influence physical health, including sexual habits and fulfillment. Life transitions common in later years, such as retiring, losing close companions, or experiencing limited mobility, can gradually lead to social withdrawal and a fading connection with support networks. In response to this isolation, many people turn inward, leaning more on solitary routines as a source of comfort. Masturbation, in particular, can become a self-soothing strategy, offering moments of pleasure, relief, and emotional grounding when interpersonal connection is scarce. For many older individuals, self-pleasure is a healthy and constructive way to meet essential needs for touch, intimacy, and physical expression. Still, while these solitary practices are natural and often helpful, they're just one piece of the larger puzzle. Striking a healthy balance is key. Over-reliance on solitary coping methods can, over time, deepen a sense of disconnection, making it harder to reach out or rekindle deeper emotional bonds. Persistent isolation may also trigger or worsen symptoms of depression, anxiety, or listlessness, reinforcing a difficult cycle of withdrawal. That's why it's so important to actively pursue social interaction, even when it feels unfamiliar or overwhelming. Whether it's joining a local group, attending senior fitness classes, volunteering for a cause, or reconnecting with loved ones, these small actions can revitalize your sense of belonging. Meaningful engagement brings emotional enrichment and can even renew your connection to your physical and sexual self by boosting confidence and self-value. Communities and medical professionals can make a tremendous impact by nurturing inclusive, welcoming spaces where older adults feel truly acknowledged and appreciated. Social events, Peer support circles and wellness initiatives can serve as vital bridges to connection. Fostering relationships not only strengthens emotional resilience but also supports a fuller, integrated sense of well-being where mental, physical, and sexual health are treated as interwoven elements of a vibrant life. Number 5. Sexual health and communication. As we grow older, our bodies and emotions naturally shift, often influencing our sexual experiences. It's common to notice changes such as reduced sexual desire, alterations in natural lubrication, or difficulty sustaining arousal. While these transitions are entirely normal parts of aging, they can introduce hurdles in intimate relationships if not openly discussed. Honest conversations about these changes can build stronger emotional bonds, deepen empathy, and support a more connected partnership. For many seniors, physical closeness like touching, embracing, or simply spending quiet moments together may become more meaningful than intercourse. Others may still find joy in maintaining a broad spectrum of sexual activity. By sharing evolving desires and comfort levels with a partner, couples can ensure both emotional closeness and physical satisfaction are nurtured. Discussing topics like masturbation can also be illuminating. It offers a safe space to understand one another's needs, reduce misunderstandings, and discover fresh ways to experience pleasure whether alone or as a couple. This kind of openness helps remove shame, boosts emotional trust, and promotes a healthier perspective on sexual wellness. Health concerns are another important aspect to acknowledge. Conditions like arthritis, heart disease, or diabetes may affect stamina or sensitivity. Addressing these realities together allows couples to adjust expectations and try new approaches to intimacy. Consulting with healthcare professionals about treatment options such as medication, hormone therapy, or pelvic exercises can lead to improvements in both physical comfort and confidence. If emotional challenges or past trauma are interfering with intimacy, working with a qualified sex therapist can be tremendously helpful. Whether you're coping with self-image issues or nervousness about aging bodies, professional support can provide tools for healing and personal growth. Ultimately, maintaining open and respectful communication about sexual and emotional needs leads to deeper connection and mutual care. With thoughtful dialogue and a shared commitment to understanding, older adults can continue to enjoy a rich and satisfying sex life that grows with them. Number 6. Exploring new techniques. As we age, the ways we experience physical pleasure often evolve, calling for a refreshed approach to intimacy. What once worked easily may now require more thought, flexibility, and curiosity, but this shift can be a chance to rediscover yourself in beautiful ways. Trying different types of lubricants can dramatically enhance comfort and enjoyment, adding variety and richness to the experience. Each type, whether water-based, silicone, or oil-based, offers its own set of textures and sensations. Finding what suits your body can unlock a smoother, more satisfying experience. In addition to lubricants, the use of sexual wellness tools designed specifically for older adults can make a transformative difference. Many modern devices are made with thoughtful features like easy grip handles, simplified controls, and ergonomic designs to support those with limited dexterity or joint concerns. Vibrators, for instance, come in a range of intensities and forms from soft, external options to more powerful, full-body devices, giving you the flexibility to choose what feels most comforting and effective. Some are even designed for dual stimulation, targeting multiple areas at once for heightened satisfaction. For those with arthritis or reduced mobility, user-friendly options such as wearable or remote-controlled toys make intimacy more accessible and less physically taxing. Exploring tactile experiences like warming or cooling sensations, or textured surfaces can also reawaken new layers of pleasure. Creating a soothing environment through dim lighting, gentle music, or calming scents enhances the overall moment, allowing you to be fully present. Taking your time, focusing on how your body responds, and honoring your changing needs can turn each experience into a meaningful, empowering ritual. Sexual wellness remains a vital element of a joyful, balanced life. Embracing this stage with care and openness allows you to continue enjoying deep connection and personal fulfillment. Number 7. Seeking professional advice. Reaching out to a medical professional about sexual concerns, whether related to self-pleasure or broader intimacy topics, can be a powerful step toward clarity and peace of mind. Healthcare providers are equipped to deliver tailored advice grounded in your unique health profile and lifestyle. During a consultation, your doctor can explore any discomfort or medical conditions that may interfere with sexual enjoyment. They'll also help identify how specific health issues, prescribed medications, or lifestyle choices may influence your sexual well-being. It's helpful to view sexual health as an essential component of overall wellness, just like physical exercise, diet, and emotional health. Talking openly with your doctor can demystify confusing symptoms, challenge outdated beliefs, and help you understand what's typical as you age. Moreover, your provider can assess if sexual habits might be impacting your mood, relationships, or daily life. If needed, they can recommend adjustments or supportive therapies to restore balance. When concerns linger or become distressing, timely professional support can prevent them from taking a toll on your quality of life. For persistent issues or deeper emotional roadblocks, your doctor may guide you towards specialized counselors or support groups. These resources offer safe, non-judgmental spaces to explore your concerns and find empowering solutions. Prioritizing your sexual health with the same attention you give to other aspects of wellness can lead to greater confidence, understanding, and overall satisfaction. Number 8. Embracing your sexuality. As we move through the different stages of life, it's essential to recognize that our sexuality remains a meaningful and enduring part of who we are, no matter our age. For many people in their 70s, 80s, and even beyond, the desire for sexual pleasure does not fade. In fact, it can play a powerful role in supporting happiness, emotional connection, and overall well-being. By acknowledging and accepting this part of ourselves, we open the door to a more fulfilling experience grounded in confidence, authenticity, and joy. Numerous older adults discover that putting attention on their sexual well-being brings a revitalized sense of connection to their physical selves. This might involve enjoying different forms of intimacy, whether solo or shared. In later years, sexuality can evolve to focus more on the emotional richness and comfort of the experience, rather than being centered on performance or expectations from earlier life. With age often comes the permission to explore sexual expression in a way that feels truly personal and satisfying. It's equally important to look at sexual health from a whole-body perspective. As physical changes arise with age, staying aware and making thoughtful adjustments can help preserve comfort and enjoyment. For example, hormonal shifts may lead to dryness or reduced sensitivity, such as vaginal discomfort for women, or erectile difficulties for men. These are normal and manageable changes. Fortunately, there's a wide range of supportive options, from lubricants and hormone therapy to strengthening exercises and professional counseling, that can help sustain a healthy and enjoyable sex life. For some individuals, this chapter also brings the opportunity to explore new forms of closeness. Whether it's through new types of touch, sensory experiences, or nurturing deeper emotional ties, expanding what intimacy means can be deeply rewarding. Honest communication is a cornerstone of this process. Talking openly about needs, preferences, and physical changes allows couples to build a stronger sense of mutual understanding. Those who make space for these conversations often find that their intimate relationships grow more emotionally rich and deeply connected. In addition, masturbation remains a valid and beneficial expression of sexuality well into older age. It offers a natural way to relax, improve mood, foster body awareness, and maintain sexual response. When practiced with openness and without guilt, it can become a tool for self-connection and confidence. Many people discover that tuning into their body's needs and responses brings a new level of satisfaction and self-appreciation. In addition to physical pleasure, sexuality in our later years can also deeply support our emotional and psychological health. Intimate connection often provides a sense of closeness and emotional grounding, reminding us that the need for touch, affection, and companionship is timeless and deeply human. For individuals who are single, widowed, or exploring new relationships, it's just as essential to acknowledge personal desires while being mindful of emotional readiness and personal comfort. To conclude, while growing older brings unique changes to sexual health and habits, masturbation and intimacy remain vital and enriching aspects of life. By understanding how aging influences our bodies and emotions, embracing flexibility, and fostering open communication and self-care, older adults can continue to experience rewarding and joyful sexual expression. Accepting and celebrating this part of yourself can open the door to a more empowered, connected, and joyful life, one filled with warmth, confidence, and personal meaning. Thank you for being part of this thoughtful conversation on sexuality and aging. We hope you found valuable knowledge that supports your journey and offers new ways to connect with yourself and your body in a more fulfilling and compassionate way. We'd love to hear your thoughts. What is one insight from today's video that resonated with you? Leave a comment below, and share how you might apply it in your daily life. Your voice might uplift and guide someone else walking a similar path. If you enjoyed this video, please leave a comment, and don't forget to like, share, and subscribe to the channel. Your support helps us continue creating content that matters. Thank you for watching, and take gentle care of yourself.